Dr. Shravani Durbhakula is a specialist in chronic pain at Johns Hopkins Hospital, and she is here to talk to us about what is possibly the connection between pain management and the things that are going on all around us, which is COVID. Doctor, nice to have you with us.
Thank you so much for having me.
A lot of folks are talking about the pain they're experiencing with COVID-19 and managing that with something more than Tylenol, but there are a lot of dangers, a lot of pitfalls there. Can you kind of walk us through what some people might be experiencing?
Yeah, absolutely. So there is certainly pain associated with just fatigue and muscle aches and that type of thing. And those type of things really do respond well to Tylenol, ibuprofen. Those are considered to be safe now in terms of symptom management and in treating COVID-19 symptoms. There are other kinds of pains that we've been seeing. Specifically, I've been seeing a lot of patients who have kind of diaphragmatic spasms from any coughing if they end up with a lower respiratory tract infection or pneumonia. And that sort of coughing can be really, really painful. And specifically, like I said, these diaphragmatic spasms and also kind of wearing out those intercostal muscles that are supporting the lungs and supporting your chest and everything in that area. And so for that, we found that muscle relaxants, interestingly, are incredibly effective. And people say that's it can be the difference between being able to get through a day and really wanting to, just it being a very, very difficult, terrible experience. I've even had patients say, that muscle relaxant got me through and allowed me to survive. I've heard people say that. And so it's a really critical part, I think, of the treatment algorithm.
It's interesting because one thing I was surprised when I heard my brothers suffered from COVID, and he said the pain was probably worse than the breathing part, and that he really felt uncomfortable, and that management of that pain really did do exactly as you described. So what happens when somebody gets somewhat more addicted to that and continues to take that even post-COVID?
So muscle relaxants, fortunately, are typically not that addicting. It's mostly opioid medications that we find to be addicting. And there can be other medications as well that can be addicting, especially when given with opioid medications. Now, typically, people are not getting opioid medications for COVID-19. But let's say someone's already on opioid medications and then they also get COVID-19. It might be sort of tempting to take more of those medications. But, we've seen a lot of difficult and terrible things happening with the opioid crisis and COVID-19. And what we've seen is that these opioid deaths have actually increased at rates that are sort of unprecedented since the beginning of this illness. Specifically, most of that is illicit fentanyl that we're seeing that's contributing to those deaths. But really, we're kind of in a twindemic here. You've got the COVID-19 pandemic, which is hopefully soon transitioning to more of an endemic state. And then you've got the opioid crisis, which is not really going anywhere. It's continuing to escalate. And now I think as this becomes more endemic, we'll see more public health efforts focused towards the opioid crisis and curbing those deaths.
Why has that happened?
Yeah, our patients are really, and the whole nation is suffering from social isolation, reduced access to care, reduced access to things that can curb addiction, like syringe programs, and even places where they would normally go to get care. Some people are scared to go to those places due to the risk of contracting illness in those places. We've seen more homelessness, more unemployment. So there are so many factors that can potentially be contributing to this. And we know that, a lot of these patients who end up overdosing on things like illicit fentanyl, some of them did start out actually with prescription opioids. And so while we say, doctors are kind of off the hook, the prescription opioid related deaths are decreasing or at least plateauing, that's not necessarily completely true, because if we're not taking patients off of these medications appropriately, then those people might convert to using illicit substances.
So much of this is based on fear, misinformation, anxiety. What can we do to kind of calm ourselves down?
I think one thing is to go to reliable sources. So there are people who have studied medicine their entire lives and done the research and really, pride themselves on this education and being scientific and being evidence-based. So listen to those people and don't listen to people who are, maybe don't really have a lot of capacity to evaluate public health or to evaluate evidence. And so evaluating your sources and picking the right ones, I think, is really important.
Well, Dr. Shravani, thank you so much for being with us. That's great information. And I wish you the very best. Thanks so much for being with us today.
Thank you. Thanks for having me.